Summer, you can see my slide, right?
Hey y'all, this is Tracy. I'm going to test my slides real quick, just so you know.
Yeah.
All right, just to confirm, Tommy or Summer, you only see my slides, not my notes.
Correct. Confirm that.
Good. Tommy and Summer, can you hear me clearly as well? This is Tracy. Hi, Johnny. I can see your shirt.
How you doing? You sounding better today.
Hello.
Oh, Jesse called me from the phone yesterday.
Okay.
Did you say that? And
Yeah.
I see the number there.
Hi, Summer. This is Tracy. Can you confirm that you can hear me okay and clearly?
John.
Summer, I just unmuted. At the bottom of your screen.
I'm gonna head on up right now, I guess. My non-workout schedule's paid off. My little charger. Again, I'm gonna be off tomorrow.
So they need to mute themselves.
I mean, get that stuff to come off easy in the hardboard room. This started wrong with you. I saw that the other
took control.
Try to mute again.
And everyone, please remember to mute your mic and let you.
Somebody, please. Mute your mic. All right.
Oh, mercy.
Slideshow. Just by PowerPoint.
All right, guys. Well, hello. This is ADEM. It's my car insurance. Let me read that.
Hopefully that fixed it, Summer.
Good morning, everyone. Can you hear me?
Yes, Tommy, we can.
Okay. A few technical difficulties here on this end, but I'm going to see if I can keep everyone muted at this point in time, and I'm going to unmute Summers and see if it is working on our end. So let's just please. Tracy,
Yes.
I think I have you unmuted at this point, so let's check and see if everybody else can hear you.
Tess, this is Tracy. Everyone.
Hey, Trace, we can hear you.
Hi, Dixie Ann.
All right. Well, Summer's having a few difficulties on her computer end, so Tracy, if you would just like to go ahead and get started, then if we can rectify these problems, then we'll go from there. But my name's Tommy Johnson, just so everybody knows. I'm the Director for Public Health, and I really appreciate everybody being here. And I have no doubt that we're going to have 4 hours of very informative speakers this morning. So I will go ahead, and Tracy, if you would like to introduce yourself, that would be great.
Yeah, hi everyone. My name is Tracy Beamer, and I am the fluoridation engineer with the CDC Division of Oral Health. I've been in this position just a little bit over 2 years. I took over for Kip Touchon, so some of you might have known him or have heard his name before, been in his trainings before. And prior to that, I actually worked in engineering consulting for quite a few years, about 18 years, working on.
I'm sorry. Can
Hi,
anyone
Summer.
hear me? This is
Yes.
Yeah, a few technical difficulties. I'm so sorry if I interrupted. I had to hang up and call back in. But Tracy, you can continue.
Okay, that's fine. I was doing my introduction for you.
Okay.
So prior to that, I worked in engineering consulting. So I worked on mostly water treatment plant projects. So I've been around water operators, worked closely with you all. So I understand a lot of the frustrations you can have, and I appreciate all the work that you guys do. So let me start sharing my slides. So a few housekeeping things on my end.
I was gonna say, Tracy, if you want me to go over the housekeeping, I can.
Yeah,
you don't. Yeah. Okay. I'm so sorry, guys. It's just I had a few technical difficulties, but I'm here, and I was gonna have an introduction for Tracy, but I think you did a really good job. So, all right. Well, good morning, everyone. Thank you so much for joining us from wherever you are. We have several different states joining us, and we hope this class can be both informative and thought-provoking regarding community water fluoridation. A few housekeeping rules, as Tracy was saying. Please remember this class is being recorded, so as a courtesy to all of our guest speakers, please be sure to mute yourself to prevent any of the background noise from disrupting the class. Anything you're doing, we can hear you if you're not muted, so please mute yourself, whatever device you're using. So there will be time for questions during the class, and if you have any questions at any point, just type it into the chat box. You all should see a chat box located at the bottom right of your WebEx screen. And all the questions are going to be monitored throughout the class. Dr. Tommy Johnson will be monitoring them in the order they appear. This is our first class via WebEx, so just bear with us. Obviously, we had some hiccups this morning, so we got off to kind of a rocky start, but hopefully it's smooth sailing from here. Everyone here will be using PowerPoint, so we're just going to be sharing our screens. And we understand that many of you are, from wherever you are, sharing your computers or your phones, and that's completely fine. Just be sure that if you are here and participating, just make sure that everyone in your group is registered. You can see on the screen that we've got, you can register at that SurveyMonkey link. Just make sure that your name and your correct email address, correct mailing address are on there so that everyone can receive their certificate of completion in the coming weeks once this is over and we get everyone's feedback. So without further ado, let's get started. I'm hearing some background noise, so if anyone you can mute yourself. Hearing some background noise. Thank you. So we'll get started. Tracy, over 18 years of engineering experience and design. She works for the and she currently works as the National Fluoridation Engineer. She's succeeding Kip Deshawn. Kip retired and Tracy took over, and she just continues to provide that national technical leadership in water fluoridation. So please welcome everyone, Tracy Beamer.
Thanks, Summer. The only housekeeping issue I have on my end is I have two very needy dogs, so you might hear some whining in the background during these 45 minutes, but I will try to keep it at the minimum.
Yeah, I think everyone muted. There you go.
All right, Summer, can you see my screen?
Yes.
Okay, thank you.
Yeah, we got you.
All right. You guys ready for a great 4 hours, hopefully. I just want to start by thanking, and there is, I think, one person that's still unmuted. You could all try to mute your phones. All right, sounds better. All right, I just wanted to start by thanking Dr. Tommy Johnson and Summer for putting together this great session. Alabama actually really has a great and robust fluoridation program, and even in the last 2 years that I've been here, I have seen both Summer and Dr. Johnson really build up this program to, be one of the top programs in the state. So they're doing a super great job. And this isn't really necessarily an easy thing to do with a state that doesn't have a state mandate on fluoridation, like your neighbor Georgia does. So I want to start by commending the program, and then also commending all the water operators and staff that are listening on the webinar. As I think we've mentioned, probably was already mentioned, I think Johnny already put in the chat, you all are really the public health heroes that are providing safe and healthy water to all your customers. I know that water fluoridation can sometimes be a very challenging subject to approach with your drinking water customers and with the public. So I appreciate everyone taking the time to join the webinar. And as I mentioned and Summer mentioned, I have been in this role for just a little over 2 years. And I say this often, and I can tell you that there has definitely never been a dull day in the world of community water fluoridation since I started. All right, here's a quick overview of the items that I will be covering this morning. I'll give a quick overview of Division of Oral Health and how community water fluoridation kind of fits into the framework at CDC. Touch on the brief history of water fluoridation in general and kind of how it has evolved as a federal program. I'll give some details on the CDC specific activities that we do as far as community water fluoridation, and then talk about our data systems and how we go about collecting our data. Briefly touch on quality awards, and then finally move on to what's new. So I know I have a pretty packed presentation, so I'm going to try to go through fairly quickly. I also tend to speak very quickly, so if you have any questions, please feel free to reach out at any time if there are any things we don't get to during the Q&A. And I don't know what that means. Someone has requested to annotate the shared content. So I'm going to decline because it says I cannot share, I cannot control my shared content. I don't know what that means. I apologize. All right, so community water fluoridation sits within the Division of Oral Health in the National Center for Chronic Disease Prevention and Promotion at CDC. It is actually one of 2 of the effective oral health interventions that we administer and track, along with our school-based dental sealant program. One other item that obviously has been in the forefront in the last few months is infection prevention and control in dental settings, which obviously has been a lot of our focus because of COVID-19. I can say, just generally speaking, and I think this even at the CDC level and at the state level, community water fluoridation can kind of somewhat be a square peg when it comes to especially chronic disease prevention where we sit. For example, I am the only engineer and the only person that works on drinking water initiatives in our chronic disease center, which is approximately 3,000 people. So it can be challenging at times. And I know with the state programs as well, because there's so much coordination that needs to be done between the drinking water program and the water systems, it can be challenging for, everyone to get on the same page. And I know that Alabama seems to be doing a super great job at it. So just want to commend you on that. All right, so I'm just going to briefly go over our mission at the Division of Oral Health. It's to prevent and control oral diseases and conditions by building the knowledge, tools, and networks that promote healthy behaviors and effective public health practices and programs. So obviously, community water fluoridation is one of those programs that we're looking for. And just some brief highlight of some of the resources that we do provide on community water fluoridation, including the oral health benefits. I think that Dr. Johnny Johnson will go through some of that information a little bit more, but I wanted to kind of give you an idea of some of the resources that we have. I have some engineering resources, and just also reiterate that that water fluoridation does still remain one of the most cost-effective methods of delivering fluoride to all community members, regardless of age, education attainment, or income level. I think that, one of the main items that you're probably as water operators confronted with is the question as to whether the operation and cost of fluoridation is worth it. And like I said, I think Johnny will go into specifics on the benefits. But I just wanted to point out this resource that we have that's on the right of the screen that shows that, for every $1 spent on community water fluoridation by community, the estimated return is $20 for both the community and families in averted mental health costs. So you all really are providing a public health benefit for your communities. Okay, so I'm going to kind of just go through some of the basics of water fluoridation. I know most of you are probably familiar, but just for some of you that are new or just learning, one thing that we do like to stress is that fluoride is naturally occurring in all water sources. Surface waters usually have low levels, while groundwater sources can have natural levels up to over 10 milligrams per liter. I did look up specifically water sources in Alabama, and generally you all tend to have natural fluoride levels on the lower side, so you don't have a lot of water sources with really high groundwater. Based on I think the 530 community water systems that you have in your state, only 11 water systems have natural water sources that are above 6 milligrams per liter, and only 6 of those are over 1. And none of them are actually over the 2.0 milligrams per liter. And I think these systems are mostly concentrated, the higher ones, in the south and western parts of your state. This is just a more graphical look of what we could call, quote, the fluoridation cycle. It shows the various fluoride compounds and levels in both water and soils based on various factors. One item to note is that, a lot of the fluoride that we find really is kind of a result of past volcanic activity. So you can imagine that where we still have active volcanic activity, there is very large, highly elevated fluoridation levels due to the release of hydrogen fluoride. So the soils and water sources near there are usually pretty high, and then also just erosion and sedimentation over time have left some areas in the U.S. with some water sources that have high elevated levels. And when I talk about elevated levels, I'm talking about of 2.0, which you don't really have much of in Alabama. All right, so this is basically the very basics of water fluoridation. When we talk about water fluoridation, we are talking about water systems that increase the fluoride level in their drinking water for oral health benefits. So more specifically, it's the fluoride added to whatever the natural fluoride levels are in your water source, plus the added fluoride to get the 0.7 milligrams per liter, which is the current recommended level for drinking water. And I also do want to reiterate that CDC's position on water fluoridation has not changed and has been the same for over 50 years now. And it's that that drinking water is both safe and effective at the recommended levels. And this is based on over 75 years of experience and research. And I will actually go in to a little bit more of the history of that 75 years in the next slides. Okay, so just some quick history of how water fluoridation came to be. So the effects of fluoride was first studied in the early 1900s by a dentist in Colorado Springs named Dr. Fred McKay. And in this area, he observed that much of the community had brown staining on their teeth, and that's where he coined the term Colorado brown stain. What he was actually observing was what we now know as dental fluorosis. But he worked alongside other researchers and observed similar issues in a few other communities in Idaho and Arkansas. And through the next couple decades, he was able to determine 2 important items that led to further research in water fluoridation. The first one being that staining was in fact caused by the drinking water supply. And the second, that those afflicted with the condition had teeth that were more resistant to tooth decay, even though they had the spotting on their teeth. And it was in 1931 that he was finally able to determine that it was actually the high fluoride levels in the drinking water that was causing the condition. After McKay, Dr. Charlie King was the first dentist who was appointed to the National Institutes of Health. And he was able to take McKay's previous research and design the first water fluoridation studies. So originally he was just interested in kind of the epidemiology of fluorosis and how is it formed and at what levels does fluorosis appear. And based on that, on the technology at the time, he was able to determine that around 1.0 milligrams per liter, fluorosis typically didn't occur. So moving on from that and building off of the research that McKay had done and the recognition that reduced tooth decay was indicated with dental fluorosis, Dean then pushed on to further study the oral health benefits of fluoride. So in 1945, Grand Rapids, Michigan became the first system, and actually in the world, to initiate community water fluoridation. And it was such a success. I think it was supposed to be a 15-year project, and I think within 10 to 6 years, they were able to find that tooth decay among 30,000 school children was reduced by almost 60%. So obviously following these findings, water fluoridation really kind of took off and became more widespread, and more programs started being initiated all over the country. So just to kind of a quick overview, at the time, and the reason that water fluoridation was such an important discovery was that, kind of in the first half of the 1900s, oral health was not really in the greatest state. Almost everyone at that time had tooth decay. As we've shown here, it was not common for 13-year-olds to have lost. Hey, can you make sure you're on? Thank you. It was not uncommon for 13-year-olds to have lost more permanent teeth to decay. Half of all older adults had lost all of their teeth. And even in World War II, about 10% of recruits were rejected because they didn't have what was required at the time, which was 6 opposing teeth. So you can imagine 18-year-olds now that are having problems just having six opposing teeth. And of those, 40% of them needed immediate treatment for relief of pain. So, you can see at the time there was a lot of need for some dental breakthroughs, and also water fluoridation it kind of directly led to a lot of the fluoride toothpaste and other fluoride measures that we use in dental health settings. All right, so the next few slides kind of explain how water fluoridation progressed at the federal level. The U.S. Public Health Service was the main entity for community water fluoridation throughout the 1950s and 60s. At that time, when communities expressed interest in water fluoridation, the Public Health Service helped with that initiation. Additionally, they are the ones that really developed the processes that are still used to this day for sodium fluoride and saturators, dry feed, and sodium fluorosilicate, and the use of fluorosilicic acid. And also the testing that is still being done to this day at the water treatment level. So in addition to the initiation technology, they also published the first engineering booklet on fluoridation in 1963. And they were doing all of the surveillance across the entire United States and were publishing what were called at the time fluoridation censuses, which basically just covered what the status of all the fluoridation systems were throughout the U.S. at that time. So the U.S. Public Health Service was really kind of doing all of the work, all the monitoring at the federal and national level. And they also were the first, obviously, and they still are, the first to start recommending the levels that needed to be set in drinking water for oral health benefits. The first, which was basically based on Dean's very first studies, the level was set at 1.0. And then in 1962, after multiple more installations and experience, the recommendation was changed to a range that you see here. And that was in effect until the 2015 update. At the time, it was thought that ambient temperature had an effect on how much exposure you would get to fluoride, because it was thought that if you lived in warmer climates that you would be drinking more water. So that is how these ranges were determined at the time. So you can see, in the South, the ranges would have been a lot less than it would have been in the North. We thought they were going to get less exposure. All right, so the shift kind of away from the U.S. Public Health Service managing the fluoridation program happened with the Safe Drinking Water Act and the creation of EPA in the early 1970s. At that time, the focus on drinking water really started to shift towards water regulations and focusing on adverse effects due to maximum thresholds and for contaminants in the water. And on top of that, the Safe Drinking Water Act also included provisions that you could not mandate the addition of any substance to water for health benefits, but needed to be solely focused on additives that are needed to meet regulatory requirements and to reduce contaminant levels, such as chlorine, et cetera. So it was kind of at this time that the shift was from a national program and the U.S. Public Health Service to really a state program, so where all the states were more responsible for their water fluoridation programs. Between 74 and 78, EPA still did have staff on board to support community water fluoridation, but this was moved over to CDC in 1978. So talking about real quick about CDC versus EPA's role, as I noted in the previous slide, the Safe Drinking Water Act defined water fluoridation as a state program, and CDC's focus since 1978 really has been to provide support to the state programs. I do want to reiterate that water fluoridation is not a regulatory activity by CDC at any level. Our job is simply to support the states and to make sure that we can provide a system so that community water fluoridation is being done both at safely and effectively. All right, this slide gives a quick overview of EPA's responsibilities versus when it comes to water fluoridation. As you all know, the maximum contaminant level for water fluoridation is 4.0. The secondary is 2.0. And as you can see, the recommendation that CDC and the state programs are after is 0.7 milligrams per liter. So it's really kind of more on CDC's focus to be tracking what is going on in the water systems between, basically 0 and 2.0 milligrams per liter, because EPA only will track if you guys have violations. They're not going to be tracking to see if you guys are staying in optimal levels for health benefits, because that's not in their purview. So as I noted, that leaves a huge gap. We have 73% of the population that are on community water systems that fluoridate, and that's approximately a little under 6,000 water systems that really we need to be tracking just to make sure that water fluoridation is really being done at the proper levels. All right, I'm going to touch on the 2015 recommendation real quick. So in 2015, the U.S. Public Health Service updated the recommended optimal fluoride level in drinking water It had been probably over 50 years since the recommendation had been reviewed, and there obviously had been a lot of changes in the oral health in that time. Since the original recommendation, fluoride exposures, there were much more fluoride exposures that were now the norm. So that included fluoride toothpaste and other products. And data and studies really did start to indicate that water consumption did, in fact, not vary by ambient temperature as previously thought. So at that time, the optimal level was reduced to 0.7 milligrams per liter. And that was based on studies that show that this threshold still provided the maximum health benefits while reducing additional exposure to fluoride. There's one thing I do want to reiterate for you all is that 0.7 is the recommended level. There is no current recommended range, and 0.7 is the target that every water system should be striving for. I will note that we are aware that hitting 0.7 from an operational standpoint is not always achievable. So CDC does have a draft recommended operational tolerance range that has not been finalized, but that range is 0.6 to 1.0. And really, though, based on the studies and the recommendation, there is a large drop-off in benefits, less than 0.7 milligrams per liter. So we really want systems to still strive for that 0.7, and that is the goal. All right, moving on to our CDC water fluoridation activities. So here's a general list of what we do in the division. It includes conducting national water fluoridation surveillance. We provide and assist with trainings throughout the country, help develop community water fluoridation resources, and are heavily involved in providing technical assistance to states and individual water systems when needed or requested. So as far as surveillance goes, CDC releases a summary of these statistics in the form of the biennial statistics. So they're released every 2 years. These are based on the fluoridation status of what we have in our fluoridation databases and is released for all 50 states and DC. This table here kind of includes the changes between 2014 and 2018. The numbers that we really usually concentrate on the most at CDC are these bottom numbers, which is the percentage of population served by community water systems receiving fluoridated water. And as you can see, these numbers are staying, fairly steady. What we have noticed, I think, over the last 6 years is that we have been, at least on the CDC end, working hard to improve some of the data quality that we have been getting from states, especially with a couple of very large states, including Texas and California. So that's why you'll see, some small shifts in this data, but generally, I think it's looking like it's staying fairly flat. As far as Alabama's fluoridation status, so as of our 2018 statistics that were put out in August of this year, Alabama's percentage of state population on community water systems receiving fluoridated water is at 78%. And the U.S. Marker currently is 73, so you are well above the national average. Your state rank is 24. And also the Healthy People 2030 target that was just released in late August is 77.1%. So you can see Alabama is obviously already above that target as well. For those of you that may not be familiar with Healthy People that are on the phone, it's basically just a set of nationwide health promotion and disease prevention goals that are set by the U.S. Department of Health and Human Services, and it's put out every 10 years. So the 2030 targets were just released in late August, and that was the target for this year was 77. All right, so to touch on the trainings that we are doing at the CDC level, CDC launched our first web-based fluoridation training in April of 2019. I want to note that it is a free course, and it is administered through our CDC Train platform. So to give some brief history, CDC used to put on a multi-day in-person training session twice a year. One was in Tennessee and the other one was in Sacramento, California. And these classes had a cap of about 40 people and were really geared towards training the state oral health employees and fluoridation coordinators so they could go back to the states and provide training to water operators and others in their state. So that being said, we kind of had a limited audience as to who we were able to catch in those trainings every year. So with that, CDC decided to move to an online platform where, we were hoping that we would be able to get some more exposure, especially with water operators, even dental hygienists, and other stakeholders in both the drinking water and oral health communities. So as I mentioned before, it is a free training that is open to the public. So far, we have over about 850 people registered for the course to date. And quite honestly, that has been done without any, I think, really major marketing to the water treatment operators, mostly because we have been working with the states individually to try to get CEUs before we start doing some, major outreach. However, if you are interested to go ahead and take the training, please feel free. Obviously, we aren't approved in Alabama for water operator CEUs yet, but Summer, maybe that's a discussion we can have later on after this presentation. But some states, as noted here, have already went ahead and got CEUs. Currently, we're up to 7 states. With that, some of those states are actually working through their state rural health associations or state AWWA to be able to administer those CEUs, because in a lot of states you have to be certified provider to be able to even administer the courses. A lot of times we have to team up in that way. So just to give you all a heads up on that. Okay, so this is just an outline of what we have in Fluoridation Learning Online. The first 2 modules are kind of really what we would call the oral health-based sections, but they're both important. The first concentrates on the science and the history and health benefits of water fluoridation. The second really kind of goes into the state program management of it and oversight, but there are some communication items in Module 2 that might be helpful for you water operators, since I know you're really kind of the front line when you're getting questions from your community. But Module 3 and 4 are kind of really the more technical portions of the training. It goes into dosing, calculations, specifics on all the additives and safety concerns, et cetera, and even laboratory testing. So, you can take if you want to take flow, you can take any module that you choose. However, I do feel for water operators that the whole entire training would be beneficial for all you all. This is just a quick view of the landing page when you get into Flow. So you can see the 4 modules here. As you can see, the 4th one, which is, kind of really the heavy technical one, is the longest one. So these dots at the bottom right kind of represent. Also, this is just an example of some of the learning material and, kind of what it looks like in the training environment. So. And I will note that we are currently making some changes to Flow. It used to be that you had to take the entire training to be able to just get a general certificate. That is being updated, so you can get a certificate for each module that you take. And then also we are creating a resource version of the training so that people in states can take the training and use it for their own purposes. There won't be slide timers in it and, some of the things that would normally be in it. So I will let everyone know when those are available. We'll probably reach out to those who had already been registered before if you've already taken the class. And if not, we're going to do some communications from CDC to let people know that these resources are out there. All right, moving on to our data collection and our data systems. So we have 3 data systems that portray community water fluoridation at within the Division of Oral Health. The first being the Water Fluoridation Reporting System, or WAFERS. This really is the main data platform and is the backbone for the other 2 systems, which is My Water's Fluoride and Oral Health Data, which are the public-facing sites. So the data that comes out of WAFERS goes into My Water's Fluoride and Oral Health Data. So generally speaking, for the water operators on the phone, when you send in your monthly operating data to the oral health program, WAFERS is where that information is being entered into. I'm not going to go into a lot of specifics on oral health data. Currently, we are only showing kind of mapping of the biennial statistics data that we have. I think it's up there through 2018. But we are working on getting county level data into oral health data, and hopefully that will be done by the end of this year. Okay, so for those on the phone that are from fluoridated water systems, when you send your monthly operating data to the oral health program, as I mentioned, WAFERS is where that data is entered. So CDC basically hosts a data shell where the states enter and maintain all of their own data. It's a closed system that is not open to the public, so the users of the system are typically state oral health or drinking water staff that are responsible for fluoridation data in that state. And I do want to note that we do track all community water systems in our system. It's not just those that are adding fluoride. For us to get kind of a full view on the national surveillance and the statistics, we do need to have information on all water systems. So we do rely on the states to either give us some of their state SIDWIS information, and we also coordinate with SIDWIS Fed to do some updates to water system information as well. Okay, so this is just an overview of the state work activities that are required to keep the National Water Fluoridation Database updated. I won't go into a lot of detail on this. I just wanted to outline a couple items, one of which is which I've already noted, which is the monthly fluoride levels. So this is the data that's water operators.
Mine's working.
Oh.
Sort of.
Can someone mute themselves, or am I frozen? Oh, we're good. Okay. But yeah, I just want to point out that that really this data is used for many reasons. One of them. Oh, I'm getting feedback. You all hear me okay? I can hear. All right. So this data is used to determine the quality awards. And it's also really the only way that we can track the optimally fluoridated water throughout the country. And it's also, this is important information that we need to know, when we use it when we continue to do studies and look at water fluoridation as a health benefit, we really need to know all of those systems that are running in those optimal levels, so that we can make sure that we keep all of our information and our science updated and correct. So that's one major item that you guys definitely are a huge part of. Also, you know, when you send in any monthly operation information, if your status had changed as far as if you're fluoridating not, or if your population numbers have changed, that is important information that gets entered at that time as well. But otherwise, this is kind of the whole list of items that Summer has to deal with on her end at the state level. This is just kind of a quick diagram that shows the data flow. So you can see here that the water system is up on the upper right. So you all will send out your consumer confidence reports out to the public, but you also report to the state drinking water program and or the oral health program at the same time. And this information is then fed to SIDWS State, SIDWS Fed, and then we also get information from SIDWS Fed into wafers. We cannot get information from SIDWS State. That has to come from the state directly. And then otherwise, the oral health program will enter data directly into wafers, and they get sent into our public facing sites, which I already noted was My Water's Fluoride and oral health data. All right, so I do want to reiterate why the data you report to the state oral health program is important. You know, since EPA is only tracking violations when it comes to water fluoridation, and I know I've said this like 5 times already, this is really the only national program that tracks the accuracy and the effectiveness of health benefits. And also, this is the information that gives us the quality awards, which I'll go into. So CDC administers quality awards for both state awards and also to individual water systems, which you all might be familiar with, on a yearly basis. So this is really CDC's way of recognizing, you know, the great public health benefit that you all are providing to the public each year. So it's based on those water systems that have reported 12 months of data that ends up in wafers. And all of those months have been optimal. And at that point, we're calling that a range between 0.6 and 1.0. And just a side note, we are currently looking at some ways to kind of revamp our quality awards program. So, you know, any water operators or staff out there who, you know, value these awards and have any suggestions on what we could do for improvements or to incentivize, you know, continued participation, you know, please feel to reach out and let me know any of your thoughts. All right, so this is just an example of what the quality award looks like. I can tell you that for 2019, those awards actually, I think, went out in the mail just a couple days ago. We awarded this year 1,524 awards to public water systems. This is actually a slight decrease from last year, but was a little expected as I had a few states that weren't able to report just because of COVID-19 and restrictions and just the busyness of it all. So, but it's still a great number, and it's actually still more than we had in 2017. Alabama specifically accounts for 190 of these awards, which is, I think, more than 20% increase from last year. So you had 86 awards in 2018, and you have 109 awards in 2019. So you all are doing awesome, and I commend you all, and I hope you keep up the great work. All right, so I just wanted to touch really quickly on My Water's Fluoride since this is our public-facing site. So if you have any customers or public come to you and want to know more about fluoridation in your water, you can direct them to the site. Participation in My Water's Fluoride at the state level is actually voluntary. So we have 41 states that participate, showing kind of just general water system information, and 30 states that give some additional information in the form of state fluoridation reports. Alabama is one of the states that currently displays both reports and general water information. So to navigate this system, however, the public user must know the county that they live in and what water system is actually serving them. And this is kind of the landing page that when you find your water system, this is how it looks. Shout out to Montgomery Water Works if anyone is on the phone right now. But really kind of just gives general water information about the status of the water system. So does it mean that it fluoridates? In this case, yes. And then it also tells you the type of water system, the water source, the county, and the population served. And then we also do a little bit of messaging in here that the public can kind of use. You know, if you're going to go to the dentist and you know you're not in a fluoridated area because you looked on My Water's Fluoride, you know, these are things that you can talk with your health professionals on and talk to them about. So we do have messaging about the systems regarding if it's fluoridated or not fluoridated at optimal levels. All right, so this I like to show, and there's two, I'm scrolling back and forth between two page views here. So we did a kind of analysis of how much My Water's Fluoride is being used. This second page view right here is kind of really the one that's more important because this is where people actually spent time on the site. But you can see that we're getting about 6,500 page views per month, which is not a small amount. So people really are looking at your data and looking at what the status of your fluoridation status is of the water systems. One thing to note that you might think is that's a little bit interesting and that we see is that we will find spikes in our hits based on kind of just what's going on in the fluoridation, atmosphere. For instance, if any of you are familiar with the JAMA article that came out in August 2019, you can see that we had a spike here. And then back in March and April, NHANES released some fluorosis data, and we had some spikes there right after that was released as well. So, it's just kind of important to know that the people are paying attention and are keeping track of what's going on kind of in the world of fluoridation. All right, so what's new? So I just wanted to highlight that this year is the 75th year anniversary of community water fluoridation. I know that the ADA has done a bunch of webinars highlighting water fluoridation this year. I think Michigan was trying to do some activities as well. I think they actually do have some really great resources on their oral health website if anyone is interested in looking at those. But at the CDC level, we have this website. We also have this logo that you can download. And we're also working on a kind of comprehensive timeline of water fluoridation that should be finalized in the next couple months. And finally, I wanted you all to bring to your attention the new additive delivery product that you may or may not be aware of, which is the upcoming fluoride tablet system. So as you can see, this is really a new technology. We haven't really had any new technology in water fluoridation in probably the last 40 years. It's really kind of geared towards smaller communities. So we're talking about water systems, or it can be water sources that are feeding around 5,000 people or less. As you can see, it's a passive system. It's easy to handle, it's easy to operate, and it's much easier to maintain than a lot of the other systems. And clearly, even as far as handling goes, you can see that the tablet is kind of the size of, if you have a pool, what a chlorine tablet would be that you use in your pool. And the purity obviously is much more minimal than what is currently recommended. You can see in this picture only just a mask and some gloves. So, in general, I think this could probably be, a big game changer for Alabama, as I imagine you probably have a lot of rural water systems that would benefit from the system, as it is a bit more affordable and obviously much easier to maintain. So far they have done testing, in both Florida, Georgia, I think Colorado as well. And they have received approval in Florida to do a final installation. But I checked with the manufacturer actually yesterday, and they are still waiting on some final components of their NSF 61 approval, but then they will be ready to go to market and hopefully start getting some of those final installations in. One thing to note on the state side of things, though, is the only other hurdle they will still have to get through is more than likely, since it's a somewhat new technology, they will need to get state approval through your drinking water administrator to be able to get this approved in the state. And that being said, this is my last slide. It's kind of a very busy slide, but I just wanted to kind of show you the many things that go into the water fluoridation program, water fluoridation as a whole, all of the partners that we have on both drinking water and public health end of things, and all the regulatory and monitoring and science and items that, I know that you all are dealing with on a daily basis. So with that, I want to thank you all again for supporting public health. And I guess, Summer, if you want to bring up your question today, I will stop sharing. Oh, you guys, I don't think I've done that much talking in the last 7 months, so thank you for bearing with me.
Tracy?
Yes.
We have a question. Since my water fluoride is voluntary, if the state doesn't participate, is the best way to get a person's water fluoride content to their annual water quality report?
Yes, that would be the best way to get their fluoride content if they do not participate in my water's fluoride. So it would be to either get it from the annual quality report, or we suggest that they actually contact the water systems directly for that information.
Okay, and then there's a follow-up to that question that says, if we're on wells, should they be tested for fluoride content before any supplements are prescribed?
Johnny, I'm assuming you mean private wells. And yes, so CDC does not track or regulate or track private wells. So yes, but still it is our recommendation that if you are on private wells, that you do get testing done for fluoride so that you can talk about supplements if needed.
All right, we've got another one. Is it clear to water operators that 0.7 milligrams per liter is a target, not an upper limit?
So the recommendation period is 0.7 milligrams per liter, period. So that is the recommendation. However, as I had noted, we do have an operational tolerance range that we want to give water systems some leeway on, and that lower limit is currently set at 0.6. So, really the lower limit that you should be running for is 0.7. But, just to be able to give leeway, as far as being optimal, we can go down to 0.6, but 0.7 is the recommendation, period. And, I will note that some states, especially some of the couple of the mandated states, went ahead and passed their own ranges, which may be different from what CDC has, but those are the mandated states that are different from what we're recommending.
And Dixie Ann said, to answer Johnny's question on private wells, absolutely.
Yes.
And I think that's all the questions that are in the chat box at the moment.
Okay. Well, thank you, everyone. I appreciate your time. And feel free to reach out if you have any other questions in the future.
Oh, thank you so much. And just so everybody will know, we will take and send the contact information to all the speakers, to everyone that signed up for this course. If your name is not listed in the participants column, if you're listed as a call-in number, or if you are in a group of people where your name, everybody's watching on a computer screen, if your name is not listed on that participants list, please put it in the chat box so that we will know that you're in attendance, so that we'll know to provide you with the certificate.
Leave, you know.
Hey, can everyone hear me?
Yes.
Thank you. I think I got muted for a second, but we're going to take a little 5-minute break. Thank you, Tracy, for everything, and come back. Let's call it at 10:10, so we'll be right back. Hey everyone, if I could ask you to mute yourselves so that we can difficulties this morning. So just confirming, everyone, y'all got me?
Yes.
Thank you. Okay. All right. So thank you, Tracy, so much. That was a great presentation. Thank you guys for the questions. Be sure to put them in the chat box, and we'll monitor them. Like I said, at the end of each presenter, we'll be able to go back and read the questions that you all have. So, all right. Our next speaker is a pediatric dentist from Pinellas County, Florida, and he's also the co-founder and president of the American Fluoridation Society. He has delivered presentations, training, and testimony about fluoride in numerous states, including Kansas, New York, Pennsylvania, Texas, Wisconsin, and his home state of Florida, as well as in the UK and Canada. His leadership role in fluoridation advocacy began after his county commission voted to end fluoridation to more than 700,000 residents. And this was a decision that was successfully reversed after he worked with others to form a coalition in Clearwater, St. Petersburg, Florida. He was a key source of information for the reporters and editors who helped the Tampa Bay Times win a Pulitzer Prize for its coverage of the fluoridation issue, and he received his dental training from the University of Florida. Additionally, he earned his certificate in pediatric dentistry with a Master's of Science from the University of North Carolina at Chapel Hill. So without further ado, please welcome Dr. Johnny Johnson.
Good morning.
Yep, we got you.
Excellent, excellent. Well, thank you all very, very much for having me this morning. I am a down in the trenches, brought up from pretty much poor background in as far as income. My parents had very little. I have a mouthful of, well, I call it a Mercedes Benz many times over in crowns, root canals, and soon to be an implant. I absolutely want to take my hat off to those of you that are on this, that are in the water arena, fluoridating water. You have hugely impacted the health of our country, not only in oral health, reduced cavities, but in general health. I'm a dentist. I've seen hundreds of thousands of kids over my practice time. And I will tell you that those that come from fluoridated communities, you can absolutely tell when they walk in your door who has had fluoridation growing up and who did not. It is that much of a difference. So thank you for providing safe drinking water to us. That's what separates us from the rest of the world. And also, thank you for providing fluoridated water. You are preventing more cavities by adding fluoridated water than all dentists in the United States and hygienists and physicians will ever prevent in their lifetime. For your information, I will kind of build on this just a little bit. This is me. I get nothing for doing this. I take no money, personal monies to as a income. This is all done as volunteer work. And when I'm not doing this, I'm out on my tree farm clearing out a few hogs, feral hogs. This one I was just taking a little while ago. 22 Magnum, if you're interested in that. I'd like to just briefly discuss what Tracy touched on was, how do we discover fluoride's reducing cavities? And that was in 1901 by the modeling on teeth. in people who had very high fluoride levels in their water down in Colorado Springs. There are those, the difference between what I can talk about and what Tracy can talk about is that I'm from the private sector and I can talk about things in a way that can get down and dirty, basically. We get in the trenches to fight the battles to help all communities that are having battles with fluoridation and keeping it, restarting it, and initiating it. Whereas those in public health cannot do that. Our American Fluoridation Society formed so that we could help communities to know how to fight these battles and to bring public health folks into the arena to help keep fluoridation going. So I can say things that they can't, and I'm not going to tell you anything that is not based in solid evidence, scientific evidence. Those that, again, will have you believe that water operators and management folks, because fluoride not being able to be gotten rid of, we were taught in dental school it was good for us, and so they began, it was good, actually good for preventing cavities, and so these companies like Mosaic decided to teach us that it was going to stop cavities. So somebody with a shovel started just tossing it in the water. That's absolutely ludicrous. We found out about fluoride's benefits in 1901, and it's been nothing but wonderful since then. We replicated Mother Nature in 1945, and fluoridation has worked and grown every year since that time. So let's talk about fluoridation, what it is, how it works, and why it matters. Covered what it is, and it's a simple adjustment of fluoride levels that are already existing in all water up to the or down to the level which is considered optimal. There are places where it is way too high, and they have to reduce it by mixing it with water that is suboptimal to down to 0.7, or to use a reverse osmosis system as a water treatment facility and then add it back in. 0.7 parts per million is optimal. When you're in a water plant, 0.6 to 1.0 is the proposed range. And for those that are not familiar with an operational range, it's like if you're driving your vehicle down the road at 70 miles an hour, 0.7 parts per million, you may go up a hill and get down to 60 miles an hour. You may come, if you're going up a hill, you may go to 60. Going down, you may get up to 70 or 80, or if you're like me sometimes, you shouldn't be at 100. But there's a range that you have to stay within to be considered in compliance. 0.7 is the optimal. Under 0.6 parts per million, the cavity fighting benefits of fluoride fall off precipitously. We need it at 0.7. In some states, as Tracy said, go up above already without the CDC's final recommendation at a optimal level, upper range of 1.0. Both internal effects of teeth as well as external effects on the teeth. Fluoridated water gets into the system by us drinking the water, and it helps to benefit the permanent teeth of children that are developing under the age of 8, while those teeth are still under the gums, to become incorporated into those teeth and to make them less likely to get cavities. They're harder from the inside out, in other words. It also, through fluoridated water and toothpaste, mouth rinses, products like that, they help to coat the outside of the teeth with fluoride, with low levels of fluoride all day long. And that is the outside benefit of fluoride. Fluoride works both ways. One way is not exclusive of the others. And we used to think that only children benefit, but in fact, adults benefit. And in my view, adults benefit more than children because we are adults longer than we are kids. And I am 64. I've got gum recession. Any of us that has gum recession know that we get roots exposed, and roots are softer tooth structure than the crowns of our teeth and get cavities a lot easier. Cavities are the most common chronic disease of kids and teens. Most common chronic disease of kids and teens. It's infectious and it's transmissible. Babies are not born with bacteria in their mouths. We give it to them when we kiss them. My mouth, my bacteria producing, my wife's was not. I would never kiss my girls on their lips because I was not going to give them my bacteria that would cause them more problems, and it worked. Toothaches cause severe pain, difficulty in focusing in school, for adults and being able to focus at work when you're if you've never had a toothache, you don't understand. It's best described as, one person said, a bee sting that won't go away. It is costly to treat and people even die from it. Looking at this young lady, you'd swear she was beat up. That's not the case. She has an abscess in her upper molar, and that abscess is causing her face to swell. The pus is getting into her cheek. Her eye is starting to close because that infection is creeping into that area where she has a vein that runs between her brain and right behind that eye. We all have that. Those veins do not have valves. And one of the easiest ways, one of the unfortunate ways that people die from death, abscess teeth, is by a brain infection from an abscess tooth. And these are just two of many examples of died from abscess teeth. Please understand, a cavity is not just a hole in the tooth. It is an infectious disease that has to be knocked. As Tracy said as well, 1/4 of all cavities are reduced simply by fluoridating the water. It doesn't matter how much medication you have, what your age is, it benefits everyone by just turning on the water. The Mayo Clinic even recognized this years ago when they were founded that oral health is a huge benefit, overall health of patients. They call it a window to your overall health. Cavities are unevenly distributed. Children from low-income families have twice as many cavities as those that are not. It's very disproportionate. Alabama has a 15.5% poverty level. That's almost 760,000 people. I did some quick analytics on how many people on water system in 2018 did not have fluoridated water. And that was you had 3,380,000 people on fluoridated water, and you have over 4 million that are on fluoridate, that are on water systems that are not fluoridated, giving them cost savings of what those people, how much money those people that are not on fluoridated water that are on water systems would have. It would be a savings of almost $31 million per year for those families fluoridated water. It is imperative that we get fluoridated water for good money. Fluoridate the water at a water plant. You will stop cavities that are in children. The ones on the upper teeth started most likely from nursing bottles filled with milk, or sweet water, as they call it in North Carolina, where I trained, water with sugar in it. But the rest of the cavities are also ones that have been that have happened since the time that those teeth came in. And you take and add fluoridated water, fluoride to your water, you knock out hospitalizations for treating these kids, which has been estimated to be $10,000 to $15,000 per child. This is what you're looking at after that child was taken care of. They had to go to the hospital. put under general anesthesia, which is putting you to sleep near death and waking you up. And then you have stopped cavities. You have stopped children from going to the hospital by 2/3 to 3/4 simply by fluoridating the water. You should be very proud of that in the water operation arena. Very proud. That's one of the most horrific things that we deal with. As a pediatric dentist, this child has to wear this stuff until these teeth fall out. Essentially, we've created a dental cripple, someone that's going to be made fun of by their peers. That's a shame. We can prevent it, and everybody feels the financial impact of fluoridated water or lack of it, because we all pay for it, whether it's through our increased insurance premiums, having to pay taxes to cover what hospital losses are from people who don't have insurance, or we're paying increased taxes for Medicaid coverage for kids that are having more cavities because of not having fluoridated water. It is a preventable disease. Now, I'm not saying fluoridated water will stop everything, but when you look at studies from around the world, cavities are prevented simply by fluoridating the water in the range of 25 up to 50% or more, simply by fluoridating the water. You don't have to change a single thing that you do. Do we want you to brush with fluoridated toothpaste, floss, eat a balanced diet, get a regular checkup? Of course we do. But the most simple thing that you can do that doesn't change a person's behavior, require any change in a person's behavior, is to drink water. It's been called one of the great public health achievements of the 20th century, right up with seatbelt, safer mothers and babies, immunizations. These were 10 of the greatest achievements in the 20th century. Again, fluoridation reduces cavities by 25% over a person's lifetime, above and beyond what's already offered by fluoride toothpaste and other methods. And as of 2018, we have over 207 million U.S. residents on community water systems that have fluoridated water. That's nearly 3 out of 4 people. That is going to grow. There's a strong consensus of support for fluoridation. American Water Works Association, Department of Defense. You wouldn't expect Department of Defense, and I'll show you why they back it. Plus health organizations and medical organizations, all leading health and scientific organizations in the world support water fluoridation. Not a single one, credibly recognized organization, opposes it. Not a single one. Let's look at what happens when fluoridation is stopped. We know that when we start it, you'll get at least a 25% decrease in cavities in adults and children. 3 communities stopped it in the last few years, which is great because we have data now that we know what's going on, and we have good studies that have shown it. I say great. I'm saying that kind of in a not sarcastic, but it's great because now we can show that what opponents of fluoridation say it prevents 1 cavity in 40 years is absolutely bogus and ridiculous. And we know that as clinicians, and we know that as researchers. Juneau, Alaska was one where cavities were looked at before and after fluoridation was stopped. And Juneau is the capital of Alaska, and it's a very difficult place to get to. So they had a great group of people they could look at. It is accessible by ferry or airplanes, small airplanes. And what they was when they stopped fluoridation, kids under the age of 7 got 1 more cavity-related procedure per year. That means root canal, that means stainless steel crowns, fillings, extractions. It means 1 more per year. Well, maybe that doesn't sound like much to a person who's making a decision, which is on fluoridating or not, which is local level in this country, which is a shame, but that's where it's at. Take a kid in Juneau 30 kids, let's say, in a preschool class, just 30, and 30 that were before fluoridation stopped and 30 after fluoridation stopped. In that first year, that group without fluoridation, they would have 30 more cavities in their class. The second year, they'd have an additional 30 for 6 than the group that had fluoridated water. By the next year, they would have 90 more cavities. It begins to add up when you're looking at an entire group. It begins to add up. That is huge. It same bore out in Calgary, which is in Alberta, Canada. Calgary, 2011, my county stopped. They were comparing 2 cities fluoridated, Calgary and Edmonton to the north. And what they found was going up in both cities, which we know our junk food eating helps to raise it up in all cities across the country. When they compared the two, there was a 146% increase just after 3 years in kids in second grade of Calgary to Edmonton, 146%. That's unbelievable. Looking at Windsor, Canada, Ontario, they stopped fluoridation in 2013. They said to the health department, track it, look the next 5 years and come back to us. It was very responsible. 5 years later, back and they gave the data that showed that there was a 51% increase in cavities and emergency dental needs in Windsor. Windsor has voted to restart fluoridation based on that information. That is huge and critical. A healthy mouth is also critical to homeland security. You wouldn't think that. As Tracy said, borrowing this with a highlight, recruits into World War II were rejected because of poor oral health. They didn't have teeth to chew with. If they didn't have 3 teeth on the top meeting with 3 on the bottom, they were rejected. And let's face it, you got to be able to eat. That doesn't mean they didn't have some other teeth around, but they only had to have 3 against 3 to be able to chew their food. And 40% needed immediate treatment. That's World War II. Well, that's a long time ago. Guess what? It's still an issue. U.S. Surgeon General Jerome Adams said, we have about 50% of our Army recruits right now that cannot be deployed because of their dental issues. That's now. That's Homeland Security. What happens when someone in Afghanistan or Iraq or another country and they are in the midst of protecting our country? They have a toothache. Now that person has to be airlifted out of that unit. That is putting in danger the tracking them as well as the unit that they're coming from. It's putting everyone at risk. This is a serious homeland security issue that water fluoridation improves our ability to keep our forces in the. How do we know that fluoridation is safe? Are done around the world all the time to see that water fluoridation at levels of 0.7, 1 part per million in other countries. That's what they have their levels set at. Still safe for us and cause absolutely 0 health effects. Been found over and over and over again, and the most recent publication was from the Archives of Toxicology, which found that there are no health effects at the levels used in Europe, which is high per million. We are at 0.7 parts per million. Again, Google on the National Library of Medicine, which is the science website that publishes credible, and you Google water fluoridation, and there's over 6,000 studies that have been done over the last 75 years and continue to be done, showing that it is safe and effective. Now, one piece of literature that you're hearing about that is not, excuse me, that is in the news right now is the toxicology programs look at fluoride in our water is naturally occurring or added, and does it cause any possible developmental problems? Well, that came study that was in Canada, and the Fluoride Action Network, which is the group here in the United States, they asked to have the National Toxicology Program do this and see if it was an issue. Well, the National Toxicology Program looked at it last year, and they said that it is a presumed neurotoxin based on their evaluations. I won't go into a lot of details, but I will tell you that there are politics in every aspect of our world, and there's politics in this group as well. I won't trash anyone, but I will tell you that people are being held, their feet are being held to the fire to show what they said and why they said it. They had a peer review done of their systematic review. That peer review was extremely critical of what they said and how they arrived at their conclusions. So the National Toxicology Program went back to the drawing board, and they just released a revised report on September 16th. And in that revised report, they said that they did not find a relationship between neurotoxicity, in other words, IQ scores, and fluoride levels that are used for water fluoridation. They only saw it at over twice of what fluoridated water is at 1.5 parts per million. And that conclusion has not yet been reviewed by this group at the National Academies of Science, Engineering, and Medicine. They are going to do a peer review of that new release, NTP monograph. They heavily criticized the previous one because of the quality of research and analysis that NTP had relied upon. So, folks, the jury is still out, but fluoridated water was shown not to be a presumed neurotoxin. Canada that I referred to was one that was done and published in the Journal of American Medical Association Pediatrics. I will tell you that journals publish articles seem very, very good at times, and at times they are found later to be not so credible. One by Andrew Wakefield, who stated that immunizations caused autism. He would not release his data. When he finally released his data, it was found that there was no connection to autism. He lost his license in England, and that was one that showed that absolutely did not happen. It was published in the prestigious Lancet Medical Journal. Lancet retracted it afterwards. So journals make mistakes. I will also tell you that this group in Canada will release their data for other people to analyze. We paid for it in the United States. The National Institute of Health paid for this study. And this group will not release their data to be evaluated by independent groups. That is not the norm. When you do a study, you let other people analyze it. And that is how we keep scientists' feet to the fire and make sure they're doing their work. So what did they really find? They found that between not and fluoridated communities on kids that were 3 to 4 years old had only a 0.1 an IQ, and that's over 108. 100 is considered normal intelligence. Their overall score was less than 0.14. They took a dive and a dive and a dive until they found a subgroup where they said there was a significant IQ deficit in boys, but not in girls. Actually, girls had an increase in IQ. Well, the author came out, which is so atypical, but Andrew Wakefield did the same thing. Came out and said, my study showed this, my study showed that. Well, one of the co-authors that group, that study, said that she stepped out and said, this does not mean that pregnant mothers need to eliminate fluoride, and it benefits the public. As in pregnant mothers, it is the only public health program that is viable in the U.S. given our current healthcare system. I disagree with the main author of that study, Christine Till. Christine Till sounded like she reversed her position later, a week later, saying that we're not saying that people shouldn't drink fluoridated water. A very prestigious group in Canada took a look at that study. This is a group called the CADTH, Canadian Agency for Drugs and Technologies in Health. They looked at it. They were appointed independent group by the Canadian governments and provinces, and they said that the conclusions of that study were not supported by the data. Not data. And yet the data for the entire study will not be released by them. Parents' IQs in that study? No, they did not. Did they measure anything between the time the mothers were drinking fluoridated water and the kids were tested at 3 to 4 years of age? No, they didn't measure anything that the kids came in contact with. Collect data on both parents' socioeconomic status. They did not use a reliable method to measure the actual fluoride exposures. And they did not use a sample that was representative of all Canadians. So there were problems with the study. It was a good study by good people, but at the same time, there were a ton of holes in it forthcoming on helping to allow others to have this data. The Archives of Toxicology, which is a group of toxicologists that analyzed human and studies on fluoride levels in water. And again, like I said before, they found that in Europe, at 1 part per million, there was no neurotoxic effects. They went on to further say about this study in Canada that they didn't say the age between 3 and 4 years old when that test was taken. And that may be problematic. As we know, when we have kids, have a child that's newly 3 years old and one that's almost 5 years old, there's a huge difference in the IQ of those kids. You got to take that into account, and they did not. I'll go through claims by fluoridation opponents, and I'll try and speed up here so that I don't take up too much time for questions and answers. Fluoride being a neurodevelopmental toxin. Well, in 2015, a huge study was done in New Zealand. It was 38 years in research. They measured IQ of kids at the ages of around 7 to 8, and again at age 38. And they did it several times at the young ages. 1,000 people were retained between fluoridated and non-fluoridated communities, and they found no link at all between those groups. A study that just became accepted for publication was done in Sweden. Sweden does not fluoridate their water, but these two Swedish economists looked at how much fluoride is in the water naturally, from almost nothing all the way up to 1.5 parts per million. That's the maximum that they're allowed to drink. That's according to World Health Organization. What they found was that the best oral health was, as we know, 0.7 parts per million. They also evaluated the IQ tests that were available. They had over 81,000 subjects, and they found zero effects on cognitive ability. And further yet, they found a positive outcome on their economic labor market. This is a huge study that is likely to never be repeated. I hope it does get to be, but we're talking about one study from Canada that's trying to be used to change public health policy that we know works. And we don't have study problems over and over. There has not been IQ issues found. The EPA petition said the Fluoridation Action Network. They put in that the studies that they had, animal and human studies that have been evaluated over and over again, were showing issues with IQ deficits. The EPA said, no, it doesn't set forth a neurotoxic harm in water fluoridation from to humans. So the Fluoride Action Network and others have sued the EPA, which you have undoubtedly heard of. Let me just say this. The fluoridation has been sued in U.S. courts 108 times over the last few decades. 108 times. And it's never been found to be illegal in a court of last resort. We will follow the same way. Opponents say that the National Toxicology Program should conduct a study on animals because new animal studies being done by the NTP were going to be very controlled and they would be great. They even bragged that it would end fluoridation on their website. End of that study, there were no IQ issues. There were no of the 9 different tests they conducted. And they looked at fluoride levels of 0, equivalent to 0.4 or 0.7 parts per million, and equivalent to the maximum contaminant level of 4 parts per million. Nothing showed up to be affected. So why do we have a small group of people that oppose fluoridation? Well, they are small, but now they have the internet to use, and they are frightened pregnant mothers, which in my book is absolutely unforgivable, making them think that they are causing their children to have lower IQs. That is a total disrespect for anyone's healthy teeth, healthy bodies, and healthy lifestyles. It's unforgivable. This is a nice long list. You'll have an opportunity to see this because available to you. But the claims they make are longer than both of my arms, and they are all incorrect. The way they use it, throw something like this. This is Rita. It's my girlfriend here. She helps protect my goats. That stuff that she puts out of her back end against the wall, and they're going to hope something finally sticks. Well, it's not. One of the prime examples that they like to say is Mother Nature protects babies from fluoride. It's less fluoride coming out in breast milk, and Mother Nature knows best. But we do encourage breastfeeding for nutrition and antibodies. But Mother Nature was good enough to help us have doctors and brains who studied what babies needed, infants needed. Lack vitamin levels of D and K at appropriate amounts, and also iron. If you do not supplement them within a few weeks after birth, they can have softer bones, blood clotting issues, and anemia developing. So to say that Mother Nature's breast milk is all the babies need is to ignore health effects that can happen. That's unforgivable. They said it causes thyroid gland issues. That's absolutely totally incorrect and has been shown over and over again. There's no link. There are 3 additives, as you know, as water operations folks, that are approved by the American Water Works Association. Opponents like to say, well, it's not pharmaceutical grade. Oh, that sounds like it's reasonable. It's not pharmaceutical grade. Well, pharmaceutical grade is not appropriate for what in water fluoridation. We use large amounts of additives to fluoridate our water. Those standards that are in place for pharmaceutical grading are not under AWWA, American Water Works Association's purveyance or purview. It is under a different monograph, and some impurities are not regulated at all and could be completely adding tons of these impurities to water and harming us. Opponents like to tell you that randomized controlled trials have never been done on fluoridation. Well, that is true. A randomized controlled trial has never been. We had observational studies back in 1901 that were done. That's when we found, remember, Colorado brown stain. Why do we want to do randomized controlled trials? Well, observational studies like that found water fluoridation to be effective, also found smoking and lung disease connections, sexually transmitted diseases, and chronic alcohol abuse and liver issues. Are we asking that we go back and do randomized controlled trials on those? When we speak to opponents, they like to avoid that. Well, I will tell you that there is a randomized controlled trial that has been approved by the National Institute of Health recently, and it is going to be done. And it's because we want to know, as scientists, we want to know what it will show. So you're some of the first hearing about this. This was just approved. And there may be an opponent to fluoridation on this call because I recognize the name. I will tell you, they just found out as well what's going on. There's a monogram, or a program by the National Research Council. It was a study looking at the previous 10 years of studies that had been done. It was the most complete review of fluoride naturally occurring in water. EPA calls the maximum contaminant level of 4 parts per million, and at the secondary of per million. We have a couple 100,000 people in the U.S. that live in areas where the natural fluoride level exceeds 4 parts per million. Well, the anti-fluoride group likes to say that that report shows that water fluoridation is harmful, and they're wrong. It was not about water fluoridation. Levels at 2 to 4 parts per million. And that amount is set by the EPA, at which there are no adverse health effects expected to occur and the margins of safety are considered adequate. Here's what they concluded, definitively concluded at 4 parts per million, that the health effect from fluoride in water naturally at 4 parts per million was severe fluorosis. No other health systems were affected whatsoever. And that fluorosis I will get to in a minute. We have opponents calling it. We have a long tradition of fortifying foods to help us not. In the U.S. courts, they have filed case after case, 108 court calling it mass medication. It is a drug being prescribed without my permission. On and on and on. Each one has been rejected. Fluoridation, like fluorination, is about prevention. This really good, I have to laugh, because they will say that tooth cavity rates came down across the entire world, whether communities were or countries were fluoridated or not. About 1983 when that started happening. Group researchers wanted to straighten out the lines. You don't make data lines. You can't take fluoride levels at a plant and have something looking like it does on the left and then straighten. This is linear. Looked at in a country of Ireland. I cannot annotate, but I can certainly make this information. When you look at it in Ireland and that same data, like at 1984, and you looked at non-fluoridated areas, this was when toothpaste had come into widespread use. That's why the 1984 was used. When you added fluoridated water on top, you got at least a 25% reduction in cavities above and beyond toothpaste with fluoride in it. Works together. One does not replace the other. Okay, frozen here for a second. You know about dental fluorosis. So we've shown it's safe and it's effective. Fluoridated water is. This occurs at a severe level at 4 parts per million. At 2 parts per million, which is the secondary maximum contaminant level, which is set, levels of enamel colorations that are objectionable. At 0.7 parts per million, severe dental fluorosis does not occur. Dental fluorosis is a change in the appearance of the tooth enamel. It does not happen, it does not cause pain or health effects for the teeth, and it is so subtle that people don't even typically notice it. It can only occur while the permanent teeth are developing under the gums up to age 8 years of age, not after that. So what we've just boiled this all down to is we don't have health issues, it's effective, and it's safe. We may have a little more of what's very mild fluorosis to mild fluorosis in these two middle pictures. Some of these white lines are flashback from ring flashes on intraoral cameras. Off the CDC's website, when you look at very mild, we're looking for white flecks on around the edges of the teeth. You may see a little fleck here and there called mild. In dentistry, we call it snow capping. This disappears. A study over years, recently published, verified what we saw over 30 years of practice when I practiced. That goes away. Moderate fluorosis is caused by swallowing toothpaste, mouthwash, or use of fluoride products. Severe dental fluorosis, which occurs at 4 parts per million, is virtually 0 at 2 parts per million and does not happen at fluoridated water. You do not see that in this country from fluoridated water. So the question is, what do you want to have? You want to have something that you don't use fluoridated water, and where I live up here in the middle of nowhere. I go to McDonald's for a sandwich before I go out to hunt. This is what I see in people, and I'm not making fun. We don't have fluoridated water here. My kids grew up like this. This is mild fluorosis, little white spots, blown up pictures, dried off teeth under a bright light. You don't see that walking down the street. Do we still get these? Yeah, but you get a lot smaller cavities and less severe cavities when you have fluoridated water. The evidence by these groups on the left, and this is not a rubber stamp as opponents like to make it sound. These are groups: American Water Works Association, National Academy of Medicine, Public Health England, American Dental Association, American Medical Association. They back up fluoridation as effective and safe. On the other hand, no widely respected medical or health organization in the world opposes it. Don't you think one would if it was you? These are not rubber stamps. These are people that look at the literature. Summarizing, fluoridated water is effective at reducing cavities. It's safe. It causes no adverse to anyone. Saves money. $32.90 per year in dental treatment cost. Tracy told you there was $1 invested, say $20 in cost for a community. And that takes into effect building the building, all the other parts of it. You look at it from a standpoint, that person saves much in reduced dental treatment needs every single year. Taxable money. Like I told you, in Alabama, you have $31 million being spent by the people who are not on fluoridated water. That's not taxable. Can you imagine $31 million going into the tax coffers for services in the community? That's a huge boost to the economy. Fluoridation benefits everyone in the community just by turning on the tap. And it's recommended by the most respected health and medical organizations in the world, including the American Academy of Pediatrics. Folks, it takes a village. It takes people in the community. It takes our water operators and engineers. It takes leaders understanding that you are flooded with misinformation by opponents trying to make every claim that fluoridation is wrong. It makes you sick. It had started in 1945. If you've never seen the movie Dr. Strangelove, and I had, and I did not realize that that movie was all about fluoridation. I remember Slim Pickens riding a nuclear bomb down when he got it freed with this cowboy hat going, yeah. Well, I watched it again when I heard about it being about fluoridation. Watch the movie if you never have. It is great. It is all about fluoridation and the commies trying to dumb us down by putting our water. That was starting in 1945, and here we are in 2020, still talking about dumbing us down. It just ain't the case. With my rant, I'm very passionate. I fight battles on the ground against the opponents that try to stop this all the time because of using misinformation and cherry-picked tidbits of information out of good science, mixing it with their own opinions, putting it in a KitchenAid blender and pouring it out over an unsuspecting public and frightening pregnant mothers. God gave me the ability to do this. I had a bicycle accident, can no longer practice, but by God, until I go home, God calls out works. Thank you all for listening, and I'll take any questions that you have.
Thank you, Johnny. Can you hear me, Johnny?
Absolutely.
Okay, great. I've been having technical difficulties all morning, but right now we're going to take questions for Dr. Johnny Johnson. Tommy Johnson, are you there?
Everything. That's unusual.
I guess that. I guess we don't have. Do we have any questions for Dr. Johnny Johnson? If you do have questions going forward, you can put them in the chat box, and we will go back and try to answer questions that maybe we skipped over. So we're going to take another 5-minute break. Again, please make sure you keep yourself muted, but we will reconvene here. Let's call it at 11:07-ish. Okay. All right, everybody. We'll see you back in 5.
Thank you all very much.
All right. Jody, are you with us?
I am.
Hey. Okay. Thanks, everyone. Thank you, Dr. Johnny Johnson. That was awesome. That was really informative. If you guys have any questions for Johnny that you couldn't think of, like I said, you can enter them in the chat box and we'll go back toward the end and we'll try to answer any questions that were overlooked. So our next speaker has been in outside sales and sales management for the last 18 years at municipal and industrial market. He's been with Aqua Products for the past 3 years, covering central Alabama and northwest Florida. He's called on municipal and industrial water and wastewater treatment facilities. And you may have already met him in person or over the phone because I know a lot of you out there use Aqua Products, their materials. So everyone, if you would, please welcome Jody Coker with Aqua Products. And I'm going to be advancing Jody's slides for him. So Jody, if you would just tell me next slide whenever you're ready.
All right. Thank you, Summer. As Summer was saying, most of y'all are familiar with Aqua Products. We cover all of Alabama. Some of you are probably familiar more with Chad and Bobby in your territory, as I cover my stopping lines, Montgomery. But for some of you that don't know who Aqua Products is, we are a sales and service company for chemical feed and analytical equipment. So I'm going to go over today on some of the offerings that we have for how to monitor and how to feed fluoride into your system. The first slide that we got up is a prominent analyzer. Now this analyzer will do not only fluoride, but it will also monitor chlorine and your pH all in one system. And as you can see, it comes pre-mounted on a backboard with the display. The nice thing about this type of analyzer that we rep is it's reagent free. So you don't have to worry about tubing. You don't have to worry about spending monthly costs on reagents. So it's pretty simple. It's easy to calibrate. Once you get it set up, you get your sample line put in there. It will 24/7 give you a reading of what your fluoride, pH, and your chlorine is in your system. This will also tie into, if you got a SCADA system, it will tie into your SCADA system to where you can get alerts where you can set a high and a low alarm on your fluoride and your chlorine. So that way you don't have to worry about at any time if your fluoride or your chlorine gets out of hand when you're not at the well. I know y'all check the wells every day, but then there's also time after you leave the well, there's plenty of time that something could go wrong, which having this in place, you would have the confidence to know that if something did change while you're not at the well, that you would get an alert through a SCADA system to allow you to be able to make any corrections on it. One of the things it does, we can do 4 to 20 milliamps. We can do Modbus, depending on what kind of SCADA system you have. It also has a data logger in there with an SD card. So if you ever wanted to pull previous data, you can download it. It downloads to an SD card. You can take it, put it in your computer, your tablet, and upload any data and go back and look at anything that's going on with it. It will also do control, which in the next slide we'll talk about the pumps that it can tie into. But the really nice feature of it is being able to not worry about the reagents, having it all in one, because I know a lot of you want to monitor your chlorine along with your fluoride, so you can have this with one system and not having to buy multiple analyzers to get those readings. And like I said, it comes pre-made on that backboard. You just mount it to the wall in the well. You get your sample line coming in and a sample line going out, and that's about all it is to hooking the system up, and then you're up and running. So Summer, you can go to the next slide. The pump, this pump is what we call our prominent smart pump. The pump is capable of tying into the analyzer for control. That way it will self-adjust based on what you want with your flow. You can tie it in your flow, or you can tie it in the analyzer, and it will self-adjust based on what the analyzer reading's giving you. You can also tie this to your SCADA system, and you can have control over your pump and see what the pump's doing. Some other nice features about this, it has a diaphragm rupture indicator. It'll let you know if the diaphragm's out, so that way you're not losing chemical or anything. You'll know to come and replace your diaphragm on it. It's got a full control. The stroke length and everything is electronic, as you can see. It's got a digital screen, so everything's electronic on it. Prominent keeps the diaphragms and liquid ends relatively in stock. We try to ship a spare parts kit with it when you do get it. That way, if you do ever have a rupture or anything, you'll have that sitting on the shelf. But one of the great features about this pump and the analyzer is you'll know you're getting the right dosage of chemical into your system when you connect these two together. Since the pump can talk to the analyzer and let that pump know what it's doing, it'll have full control without you having to worry about making any adjustments to the pump based on your flow. If your flow for some reason changed, the analyzer would sense where your reading's at, and it would make the adjustments without you ever having to worry about anything with it. We can also tie this in with the 4 to 20 or Modbus for your SCADA, whichever kind of SCADA system you have. It also has, if you ever get an airlock or anything, it's got a detection on that where it will automatically ramp the pump up to get the airlock out. So you don't have to worry about it getting airlocked. If you're not around, it will automatically adjust for that. The pump comes in several different sizes as far as your pressures and your gallons per minute. So we would just have to size it up based on what your pressure is and what you're looking to pump gallons per minute. So we have several different sizes for it. Prominent also offers other pumps to go along with this, but the Gamma X is one of the most common for using for fluoride. We also have just came out as a little small peristaltic pump that looks just like the Gamma X, but it's a little hose peristaltic pump that can also be used for this. But like I said, I'd use the Gamma X on here because that's the most popular one we use for feeding fluoride and having it working with the prominent analyzer. You can go to the next slide, Summer. We wrap the Scaltron scales. The drum scales are typically used for fluoride drums. There's a few different controllers that we can put with this drum scale. The basic one that comes with it is just a 3.5 inch digital indicator that has the standard knob on it to make your adjustments for your tare weight. But then there's 3 other ones that get a little more complicated. If you're looking to do, actually want to monitor what's in the drum, you can even have a controller that will constantly keep a monitor of what's in the drum, give you a printout reading, or even give you a reading to your SCADA of what your level is in your drum. So there's several different capabilities with the monitoring part on this drum scale. And it's all, you can do 4 to 20. You can do scale or loop power with the 4 to 20. We can have up to some of the controllers here. You can have multiple drum scales. If you're a bigger plant, you can have multiple drum platforms tied into one display, so you don't have to have multiple displays and then have it all tied into your 4 to 20. The drum scale here will set an 18 to 26 inch drum, and it's adjustable. As you can see in the picture, we can adjust it depending on what size drum you have. We can also do, if you're not using drums for your fluoride, we do have some other scales if you're using totes or something like that. But I know typically you see it as a drum, and these are corrosive resistance. They're coated, and they do come with a 5-year warranty on them. So these can also be tied in with the whole system to monitor what you've got left in your fluoride, so you can get alerts to let you know, hey, I need to come and change this drum out. So that way you don't get in a bind where you're getting low on fluoride. You know exactly at all the times what your fluoride level is in your drum. And we can go up to 1,500 pounds with these scales. Summer, you can go to the next slide. The Lamont handheld. This is a fluoride handheld tester. It comes with a lithium-ion battery in it with a USB charger. It can be used in a lab or it can be used out in the field. It comes, you can get it's EPA approved, and you can get a case for it if you're using it for portable use. And you can keep it out in the field in the truck. It stays charged pretty good while. The charger for it is a USB, so it comes with a wall mount charger, or if your truck has or vehicle has a USB port, you can charge it through that way. It does keep up to 500 test results. So you can go back and look at your test results, look at the time it was taken, the date it was taken, up to 500, and you can set that to where it will either roll over after 500 or it will stop at the 500. And it comes with the valves and everything that you need to run your test with that. You can set it to where if you got it set in a lab situation and you want it to go off or go into sleep mode after a certain period of time, you can set it to where once you use it, you don't have to worry about turning it off and on. It will, after so long, it will turn itself off. These are pretty readily available to get. They have the same one in a chlorine style too. So if you got one already that you use for chlorine, which I know some of you do, the fluoride one works the same exact way as the chlorine one. So you wouldn't be having to go into a different style, you know, and learn something different. It works the same way as the chlorine one does. Same warranty and everything on it. And the reagents for it are readily available. And like I said, we can use this as a portable unit or a lab unit. I know mine was pretty short, but I did just, you know, the importance of the items I put together is just, they all work together. So you know that you're getting the right dosage of fluoride in your system, and there's no questions of what's being put in the system. Is it the right amount? Because we can all hook this up to SCADA. So SCADA can alarm you whether you're getting too much or too little of your fluoride into your system, which I know we'll talk about here next, about SCADA and how SCADA also can work with all this equipment and keep you up to date 24/7 on your usage and where you're at with your fluoride. But I know, like I said, a lot of y'all know us, Aqua Products. If there's anything, I'll take questions now, but if there's anything that you want to ask, think of later, you can reach out to Aqua Products. You can reach out to me directly, and if you're in north part of Alabama, I can get you in touch with either Chad or Bobby if you haven't already been in touch with them. But I'll take questions from anybody.
Hey guys, if anyone out there has questions for Jody, make sure you put them in the chat box, and Dr. Tommy Johnson will monitor questions. So we'll give you just a minute. If there's anything you saw there that you were interested in, just put it in the chat box, let us know. Also, if you have questions from previous speakers, we can also monitor those. So. All right, guys, we got a quiet group out there today.
Johnny just made a comment and said that it looks like it's a very simple to use system, especially for small systems. He's seen some small systems, and this is can be used for both fluoride and chloride. And Tom Hall is,
Tony Hall.
Tony Hall is asking for a contact number for Jody, so I can take care of that and just enter it in the chat box if that's okay, Jody.
Yes, absolutely.
Yeah, and Jody's also got that email you see on the screen, jody@aquaproductsinc.com. So you guys are welcome to contact him there as well.
Sarah was asking, is there something that can be purchased and used in other states, or is this something that can be used in other states?
Typically, we sell this in Alabama and Florida, but if you want to reach out to me, I can get anybody in contact if it's outside of my area. I can get them in contact with the right person if it's out of my territory to talk to about it.
Okay, and I just put your contact information there as far as telephone number. And we will provide email addresses as well.
Okay, thanks. And if it's anybody in the Alabama, Florida area, we can happily come out and look at the situation, especially because we do install this, all the equipment I just talked about. We do install the equipment, start it up, and do maintenance on it. So we can, if you contact us, we can come out to your site and look at installing and the appropriate, pump and everything that you would need for your usage.
There's a question that says, have you tried these out with a tablet system?
Yes. In fact, we do have, we rep a company called AccuTab, and we have a few systems that we have the tablet system tied into the analyzer. So the tablet system flow is based on what the analyzer's reading is on its residual. It actually works great on a tablet system to control the pump on the tablet system.
Yeah, those tablets are a lot larger than you would think. When you hear the word tablet, you don't think of a hockey puck.
Yeah, they're about the size of a hockey puck.
Yeah.
Johnny's comment is cost containment is critical to fluoridate the other 25% of the country. So.
All right. If there are no more questions for Jody, again, I'm sure you guys will think of them later, as I always do with things. It's like, I don't have it right now, but I probably will when this is all over. So you've got his phone number. You've also got on the screen Jody at aquaproductsinc.com, or you can reach out to him with any of your questions. And just keep in mind that at the end of this, we'll have the opportunity to ask further questions with the rest of our speakers. So that being said, we're going to go ahead and take another 5-minute break. Let's say that we come back at, what time is it? It is Central Standard Time. It's 11:28 here. Let's come back at 11:35 with our next speaker, and we'll see you guys back here in about another 5 minutes. Jason, you there? Jason?
Try him now. I think he was muted.
Okay. I was like, am I the problem? Because I've been having these issues.
No, that's a different Jason. Hang on. Let's see if we can find
Okay. I'm loving these presentations, though.
Okay, try that and see if that's Jason.
Is this Jason? Let's see. Oh, he said he's on his phone.
All right, we know he's number 7.
Okay.
All
Hey,
right.
Jason, can you hear us?
I can. Can you hear me?
I can. Thank you so much for that heads up. Okay. Let's get started. All right, guys. Welcome back. Thank you to Tracy and Jody and Johnny. And our final speaker is Mr. Jason Bell. As I said earlier, we will have time for questions towards the very end of all of this. So just anything you can think of that you didn't get to say already, you will have another chance. So let's see here. Just to follow up some of the items that were mentioned from Jody, our next speaker graduated from Troy University in 2005 with double majors in both chemistry and math. He is duly certified as an Alabama Grade 4 wastewater operator and a Grade 3 water operator. He is the City of Troy's Utilities Project Manager with over 13 years experience in the water and wastewater industry. And he's also a SCADA and integration specialist with over 10 years of experience programming, configuring, installing, and administrating water, wastewater, electric, and industrial SCADA systems. He is also a network specialist with over 9 years of experience as an IT specialist, network administrator, communication specialist, and a certified network security administrator. So, and I think that it should be noted that without his help, we wouldn't have this class or ADEM approved hours. Jason is really the one that got this ball rolling when I reached out first. So I want to commend him for that and say thank you so much. But I think one of the more important facts here is that he's a huge Alabama fan, which is my alma mater, so roll tide. Hope I didn't offend anyone out there. So please welcome Utilities Project Manager for Troy Utilities, Mr. Jason Bell.
Thank you very much, Summer. My name is Jason Bell, and I would like to touch base on leveraging some of the technologies available to ensure safe and reliable fluoridation. Earlier, you heard Ms. Tracy say it's not easy to keep the fluoride concentration at 0.7, and she's right. However, with the new technologies out there, and that's why she said that there was a range between 0.6 and 1. However, with the new technologies that we have, thanks to Aqua Products and Prominent and SCL and VT SCADA, we actually have the ability now to maintain near a perfect concentration all the time. And the technologies are not cheap. However, thanks to Summer and Oral Health and other organizations, there's grants out there that cover a majority of the cost with a very low percentage match. In fact, in the past 2 years, Troy has gone after 2 of the grants each year, and we've received over $10,000 funding to be able to actually purchase and implement some of these technologies. The grants are very easy to apply for, and they don't. One really nice thing is they don't necessarily require engineering services to implement. In fact, Jody mentioned one of his products was the Scaltron scales, and that's actually what we bought with the last grant was scales, the online Scaltron scales for our sites. And one huge advantage in having those scales at every site is you can tie them into SCADA, so you know exactly how much fluoride you have, and you can alarm on it if your fluoride level gets low, so you never have to worry about running out of fluoride. It keeps up with it for you. It also has the advantage of allowing you to monitor your usage, so you can you'll be able to see this in a little while. You'll actually be able to graph and see how long it takes to use X pounds of fluoride whenever your wells are running, or if you're a surface water plant, you know, however long you're pumping. So what's one of the main concerns with fluoridation? One of the main concerns is keeping that fluoride concentration at 0.7. And we all know, and this has been touched on, that if you feed too low, then you're not getting the full benefits of the fluoride. You're basically wasting money. And also, if you feed too high, if you get above 2 ppm, then you can actually start doing some harm. So being able to keep continuous concentration is extremely important. With continuous monitoring, the backbone that we use and we definitely recommend is what you saw Jody show, was that prominent meter. It's not only flexible and reliable, but it's something that you can take care of yourself. It's not, I know he also mentioned that they maintain them, and that's actually not necessary. You can maintain these yourself. They sell a kit for every 6 months to a year, and it's a very inexpensive kit. Like you said, there's no reagents. Every 6 months to a year, you can go in, clean it out, and use the kit to maintain it. And we've had these in the field for years, and they're very reliable, and we've had no issues out of them. So let's look at a little bit of what they can do and what we can do with them. Water systems that fluoridate are only required to check their fluoride concentration once a day. However, what's happening the other 23 hours and 55 minutes of the day? That's the gap that we really, really would love everybody to be able to feel, because if, like Jody said, if anything happens during that time and you don't have online fluoride monitoring, then you have no idea that you may have just either a piece of equipment failed, it got airlocked, or I've actually seen overfeeding occur. If the pump goes off and the fluoride pump keeps running, say your well goes off and the fluoride pump keeps running, that relay doesn't kick out like it's supposed to, and then it comes back on, then you're going to slug the system with a very large quantity of fluoride. So monitoring that all the time and being able to alarm on it and set parameters with it is really a great thing to have. Now let's look at unlimited historical data, and this is with VT SCADA. VT SCADA is the SCADA system that we definitely recommend. It has they pride themselves on being instantly intuitive, and that's exactly what they are. They're the only HMI, which is human-machine interface. Basically, it's what you see on the computer that is full featured with a single install. What I mean by that is, let's say you go with Alan Bradley's Factory Talk, and I'm not putting down any HMIs. I'm just comparing. You have an install for everything, so you have to first install the HMI itself, but it doesn't come with alarming. Then you would have to install a secondary pack called, and pay for it, called Win 911 to handle your alarming. Then you would have to install another piece to the puzzle for being able to do data logging. And then you would have to install something for your SQL database. And it gets, then you would, if you want to be able to monitor your system remotely, then you would have to install another piece that would allow you to get to your SCADA system remotely. So you want to pull it up on your phone or your tablet or whatnot. Unlike all the other HMIs, VT SCADA allows just a single install. Another huge advantage of VT SCADA is the historian, where it data logs, is very lightweight. What I mean by that is, for instance, if you look at the surveillance HMI, let's say you have 5,000 tags out there that you're data logging on. You will use anywhere between 10 and 15 gigs of data per month just to be able to data log all those. It uses a SQL database. Same thing with Factory Talk or Wonderware. However, with VT SCADA, you're able to do this, and it uses less than a gig a month for 5,000 tags. So you can really leverage. It doesn't go and fill up your database quickly. You can really leverage the intelligence of their file set historian. Another really neat feature, if you notice here on the slide, one of the things being monitored there is fluoride. You don't have to set up any graphs or trending. VT SCADA automatically sets that up for you. So you have, the scenario is, you have the prominent analyzer out in the field monitoring fluoride. You have the prominent pump, and then you have your SCADA piece, which we'll talk about, and the hardware, which we'll talk about in a second. And you have VT SCADA. You bring that in to that point, that tag, if you will, into VT SCADA, and it automatically data logs that for you. It also automatically sets up the graphing for you. And to graph it, you don't have to set anything up, like I said. All you have to do is click on it. I actually wanted to show you this in a live scenario. However, because we had to stick to PowerPoint, I'm not able to, so I'm kind of simulating it. But just by literally clicking on the word fluoride there, or any part of that, it would bring up a graph. And with the graph, if we were live, as you move your mouse left and right, it would show you the fluoride concentration over time. So this is a 4-hour fluoride concentration. This is real live data. I think if you look here at about 5 o'clock is when the well came on. I think we have it out in at 0.75. We probably need to drop that to 0.7, right, Summer? But you'll notice that as time goes on, it just keeps it right there where it should be. And we'll look at how we do that here in a minute. One of the really neat things also is it comes with a built-in export tool. So with VT SCADA, with a single click, you're able to export this to say Excel or Access or any kind of database, any ODBC database like SQL. The time interval also is from 1 second to 5 years. So there's a drop down in your graphs. So you can look at any time interval you want. You can go back in time, you can go forward in time, and you can actually see what your, if there's any spikes, if there's any valleys, exactly what that fluoride concentration is doing over time. Also, some people don't like graphs as much as grids. Like when I say grid, I'm talking about like an Excel view. So down at the bottom of the graph, there's actually a grid button, and you can view the data in a grid view, as you see there, instead of in a graph view. The data, like I said, can be exported. There's just an export button at the top. And whenever you click the export button, it allows you to select what type of file format you'd like to export in there, whether it be a CSV file, an Excel file, an Access database, like I said. And you can save it to your computer, throw it on the jump drive, email it, send it to your engineer, whatever you want to do with it. All right, interfacing with SCADA. One of the most important things to us is not only having the best equipment out in the field, which for us is the prominent, not only having the best software behind the computer, which is VC SCADA, but it's also having the very best PLCs. Just to tell you a little bit about SEL, Schweitzer Engineering Laboratories, they started out in the electric SCADA industry. In fact, I know a lot of water and wastewater people aren't familiar with them because they're just now emerging into the water and wastewater market. But over 80% of the substations in North America have SEL PLCs in them, and there's a reason for that. In fact, the city of Troy has over 50 of these in operation now. One of the things that they boast is, unlike this is unparalleled. No other PLC can boast this, but the 2411P has a 10-year no questions asked warranty. This protects against anything, including lightning damage. So all the time you may see a piece of equipment that says, hey, I have a limited lifetime warranty, but if it gets struck by lightning, it's not covered. This no questions asked warranty literally means no questions asked. If you had a mad operator that had a really bad day and got fired and decided to go out and shoot the PLC with a gun, SEL would still replace it for free. I've heard some really funny stories from the SEL guys as far as how their PLCs have been damaged. One person left one on the back of a truck, pulled up, it fell, and then they backed up and ran over it. And SEL, of course, still replaced that for free. Another thing to note is the 10-year no questions asked warranty, that's only on paper. They've been in business for over 30 years, and they've never charged for a warranty replacement. In fact, they have things that come in that's 30 years old, and they still either repair or replace them for free. They actually don't even have a line item to charge by for replacement. So in essence, it's a true lifetime warranty. But thanks to lawyers and stuff like that, they have to put down on paper a time. So they say a 10-year no questions asked warranty. Another thing that we really, really love about the whenever you're monitoring analogs like fluoride concentration is the 2411P is a true 32-bit PLC. Most PLCs out there, for instance, and I keep picking on Alan Bradley, I shouldn't, but let's say Alan Bradley, its onboard analog input is a 10-bit resolution input. If you buy its advanced module and pay that extra $400 and whatever dollars, then you get 14 bits of resolution. What that means as far as your resolution or how many bits of resolution, that tells you just how accurate and how granular your data is. So by getting down to a true 32-bit resolution means that you are looking at extremely high precision and extremely high accuracy whenever you're monitoring your analog points, whether it be the prominent chlorine or fluoride concentrations or any analog point. Another really neat feature of the 2411 is it's fully expandable and fully customizable. You'll notice in the back view of it that there are 2 blank slots there, which you can fill up with additional cards, whether it be an analog card, a digital input, digital output, or whatever you want. All right, now I want to talk about intelligent fluoride dosing. It's important to maintain, as we mentioned, that consistent concentration of fluoride when dosing your water system. As we mentioned, the 0.7 parts per million or milligrams per liter is the recommended concentration. So if you visit your wells or plant just one time a day, and how do you know that you're maintaining that concentration? We like to use another SEL product called an RTAC. It's a real-time automation controller. And the RTAC basically acts as a big brother. In addition to doing advanced logic, it oversees every well and every tank, or if you're talking about a water plant, surface water, it can oversee your entire system just in a single platform. This allows you to use it as a data concentrator, and by it overseeing every part of your system, it can make intelligent decisions throughout the system, and it can actually control your other SEL PLCs. So what we do is we use this and we write a PID, which is just a type of loop that it stands for proportional integral derivative loop algorithm that allows you to dial in exactly what concentration you want, and it will hold it there. So by writing that logic, the setup, the scenario is we have the 2411 monitoring the fluoride concentration. We also have the 2411 hooked to that prominent pump that you saw. And then we use some advanced logic and a PID in the RTAC here to tell that pump to speed up or slow down depending on your fluoride concentration. And this pretty much describes it. With the SEL 3505, you can use advanced controls to monitor the fluoride concentration output, to command the prominent fluoride pump speed up if the concentration gets low, or slow it down if the concentration gets high. And this ensures that you're always at your 0.7. And that's extremely important, especially if you're only checking your wells once a day, like most of us do, or your plant once a day. So that's how we leverage the the technologies that you saw from Prominent. And Summer, I'm going to turn it back over to you.
All right. Thank you so much, Jason. Okay, so right now we are going to take questions for Jason. So if anyone has a question for Jason, again, just put them in the chat box. I noticed that some of you are asking if this is going to be available, and it will be. We're recording, and so we'll make it available. Public Health has a YouTube channel, so we're going to get with our communications department and try to get that to you as soon as we can. This is our first WebEx, so bear with us as we, try to figure out all the ins and outs of this, but we are recording. We've got all the slides recorded as well, so we'll make sure you guys have access to that.
All quiet in the chat box.
Very quiet. Okay. Just figured I'd give y'all a couple minutes. Kind of wish it had those 3 dots you see when you text, so you know someone's typing. All right, guys. There are no questions for now. We're going to go ahead and do a 5-minute break, and we'll come back. Let's see, it's 12-ish here. Let's come back in about 12:07 would be 5 minutes from now. And we will talk about our grants that we have, that we've had for the past 4 years now. So we'll see you guys back here in about 5 minutes. Hey guys. Okay. Looks like we had a question over the break. Is this technology available in all states? Jason says yes, it is available in all states, and gave a few resources, a few websites to go to. Okay. All right, as I said before we left that I was going to go over some information. This pertains to our Alabama water operators, as they're the only ones that would be eligible to apply for this grant. But if you do have, you know, a public health department in your own state and you're listening and you'd like this type of opportunity, I think it'd be a great thing for you to start. This is going on our 4th year doing it. We put it in our budget every year to allow funding for public water systems to apply for a grant to fund their community water fluoridation. So I want to go over this, and again, we've been doing it for the past 4 years. It's our annual fluoridation grant opportunity. So many of you listening, I know, have already taken advantage of the funds that are provided from this office, the Oral Health Office, to either begin fluoridation, maintain the current equipment that you have, or the materials that are necessary for community water fluoridation. So our office is very proud to award these funds every year, and we hope that you'll all continue to apply as long as that funding is available. We really do love it when public water systems apply for these grants, because it means that we're going to have we at least know that population is going to continue to receive community water fluoridation for going on the next 5 years. The grant does, you know, specify, if you're applying for this grant, if you are awarded, that you will continue to fluoridate for 5 years. So we really love it when we're able to award these grants. So I'm going to go over some of the details. If you've never applied before, or even if you have applied before and you'd like to apply again. So our fiscal year begins in October of each year. Therefore, we normally start our application process with our grant announcement via email, and we also send out a hard copy through regular mail. So you might recall me asking you for a physical address or a P.O. box somewhere we can send, because this is why we like to do that, so we can send you a hard copy of the information. And we usually do that around August of each year. You should look out for that email around August. So I typically send out the email announcing the grant with details on how to apply. So it's going to come from me, from my email address at Public Health. If you're interested in applying, we typically take these applications from August through the end of September, because our fiscal year, like I said, does start in October. So we like to collect all of our applications, and then we like to go over them and announce who gets them in October. So grantees are announced the 1st of October, or the fiscal new year. Grantees that have already been selected for this year, and I'm happy to announce that we were able to fund everyone who applied. That doesn't always happen. That's not always the case. Sometimes we have more people apply than funding, so therefore we have to move to a grading system that we have that's also in the RFP that we send out, but I'll get to that. So again, the grant runs from October through September of the following year. So for example, this grant that we just awarded is going to go from October of 2020 and is going to close out September 30th of 2021. So it is reimbursable. It's important to note that you will have to purchase your equipment, your supplies up front, and then we reimburse you for the amount agreed upon in the grant. So you will be able to purchase those materials first. We're going to reimburse you, and we do that through invoice. So you just invoice us toward the end of the grant year, and we reimburse you for those materials. And all awardees are reimbursed before the new fiscal year. So everyone who was awarded this year is going to be reimbursed within this year, and come October 1st, you should all have your funds back. Again, I'd also like to emphasize that this is a competitive grant. This means that if we have more apply than funding available, like I mentioned earlier, then we move to our point system, where applicants are graded based on the items like need, population affected, if you've ever applied for a grant before and been denied, or if you need the funding to begin fluoridating for the first time ever. We really want our entire state to be 100% fluoridated, and the only way to do that is to get new systems who have never done it before to start. And sometimes a barrier to that is finances. And if we can help with that, then that's what we're here for. Let's see. So here's some more details, more on the finance side. Like I said, for the past 4 years, we've had $100,000 to distribute among qualified public water systems. And each system can apply, is eligible to apply for up to $25,000 as long as they meet the criteria. What I mean by criteria is you have to check these boxes. You have to be a public water system. You have to be able to enter into a grant with ADPH. You have to be approved to fluoridate by ADEM. Never had a problem with that before, so you should all be approved to fluoridate by ADEM. And you can provide a letter of support from ADEM and your local water authority. ADEM is happy to write you a letter and say, yes, you're approved to fluoridate, and yes, you're approved to acquire these funds. Applicants for the 2021 fluoridation grant, as I stated earlier, have already been selected, and I'm very happy to report that all $100,000 of that funding was used to support 6 different systems. So not every system will need $25,000. You could have, you could have 10 systems needing $10,000 each, or you could have 4 systems needing $25,000 each. So, it's really, you could really break this funding up any which way you want. What really matters is that we are funding the water systems that are in the most need. Using all of the funding for this year means that we're hopefully guaranteed to receive the same funding next year. So we really like to use it all. We like our applicants. So if you or a system is interested in applying, please have them apply when our grant is announced again for the 5th year in August. We are very hopeful. I like to be pretty positive about things, so I like to think that if you put it out there, then you'll get it, and hopefully we'll get the same funding for next year and be able to help even more systems. So the grant announcement, again, will come from my email address, and it's here on the screen for you. It's it's pronounced Macias, summer.macias @adph.state.al.us. A hard copy will also be sent to all public water systems, and we like to send them to everyone, both parent and consecutive. I do realize that those consecutive systems are pulling from their parent systems, and that's fine. But I just like for everyone, no matter what type of water system you are, to have this information, to know that we are funding public water systems and that we do have money available. So if you ever say, I'd like to start fluoridating, but I'm not sure if I can afford it, you at least know that there's a means to do that. You've got $25,000, hopefully, that we can help you out with. So I'm going to turn this over and see if anyone has any questions for me. I know that what I went over right now with these grants, you can probably think of a million questions when it comes to what a grant is and how to apply for it and what exactly the grading system is, our RFP even, our request for proposal, what exactly we're looking for. I'll go here and say the more detailed you are in your proposal, the better. We really like to fund, like I said, who has the most need. So if you can state your case in your proposal and say how, maybe you're a small system that financially may not be able to continue unless you get this funding. That's definitely somebody that we would put at the top of the stack with regard to who we're choosing to be a grantee. So, like I said, it's been 4 years. In the past 4 years, we've had well over what I'd say we had maybe 5 each year and then 6 this year. So over 20 applicants that have been awarded. So the funding is definitely out there. If you ever need any help applying, or if you're not really sure, if you've never done a grant before, we understand here that, you know, some companies have grant writers for them. We understand that, you know, you guys, you work at a public water system and that you might not have a grant writer, and that is completely fine. You know, this isn't necessarily something that we're looking to be, you know, a 20-page or even more, you know, of exactly what your proposal should look like. We've awarded anywhere from 5 pages to 25 pages. So, you know, it's just, like I said, based on need. You don't need to be a grant writer to apply for this, and I'm here to help you every step of the way. If you ever have any questions for me, my contact information is on the screen. I am more than happy to send you, you know, grant examples that we've had in the past. I know some of you, if you've never done a grant before, that could help you out a lot. So I will go ahead and turn it over to questions. Do you guys have any questions for me about the grant process? I feel like we need a Jeopardy background sound.
Dun, 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 dun,
Thanks.
That's about all I know.
Is that Dixie Ann?
This is Tommy Johnson. I was just going to jump in and add a couple of things to what Summer was talking about as far as the grant. And because of the fact that we do have some representatives from other states as far as their oral health offices that might not have thought about doing something like this in their states, just to let you know how ours works, we as in public health, our office is 100%, just the oral health office is 100% federally funded through an MCH grant. And as Summer had said, that's something that we have put in our budget each year since I have been here. And it's something that the Title V grant that we get our funding from is excited to help with because they know exactly how important it is. So just kind of to throw it out there in the event that there are some states that are listening in that do not do this, you know, like I said, it never hurts to give it a try, and it's you know, it's a really simple system that we have come up with here as far as awarding the funds. And without awarding some of these funds over these past few years, there are some of the plants that would not have been able to continue doing their fluoridation. So just a word of encouragement along those lines.
And I do know that Jason just said, having applied for 2 grants himself, he assures everyone it's not difficult. The City of Troy has received 2 of our grants for 2 different grant years. And, you know, Jason is super smart guy. But, you know, even he had questions with it, and that's okay. And I was here to help him every step of the way. And it's not hard. It's a really simple, we try to make it as simple as possible. Just, you know, knowing what a hassle it is, you know, anyway, to find funding for some of this stuff, we just want to make it as easy as possible to apply for it and then to get the ball rolling with getting you your funds. I would highly encourage, again, like Dr. Tommy Johnson was saying, any states listening that don't already have this in place, like he said, we do it through the MCH block grant, and they're so happy to help us with it. we're going to move on to questions for all. Tommy, were there any questions within this chat box or even right now? Does anyone have any questions for our first speaker, Tracy, our second speaker, Jody? Third was Jason. You know, this is out of order, and I'm sorry, but we had to kind of mix it up this morning. Our first speaker was Tracy. Our second one was Jason. And then we had Tracy, Johnny, Jody, then Jason. That's what it was. So not in the order you see it on the screen, but they were all speakers. So if you have any questions for any of them, just go ahead and enter it in the chat box.
Yeah, so far we're caught up as far as questions.
Okay, that is great.
I do know that I heard Tracy in the background, I think, so she's still on here if anybody has any questions as far as her representation for the CDC.
Okay, we're all caught up. Before we move on to a thank you, let's see here. All right. All right, we'll go ahead. All right, well, thank you, everyone, for joining us. I know it has been a long class, but I hope that it was worth it for you and that you learned a lot from our speakers. A very special thank you to Tracy Beamer, Jody Coker, Jason Bell, and Dr. Johnny Johnson. Thank you so, so much for making this class possible and for sharing your knowledge on community water fluoridation and why it's so important in regards to oral health. Please note, everyone, that in order to receive credit for this class, you must be registered at the web address that's shown on the screen. So attendees that are not registered will not receive the certificate of completion. We have to have your first name, last name, your email address, please put your correct mailing address because that's where we'll be sending it. We've been getting a lot of return to senders lately when we've been sending out our grant information. So I just want to make sure we have everyone's correct mailing address. Also, we will be mailing the certificates of completion to all the registrants in the coming weeks. I just want everyone to know who's listening that's with an Alabama public water system. We do have I've been told by Tracy with the CDC, because they're the ones that print the awards every year, that the awards are on their way. So you can look for those, even though I'm not so sure we're going to have an ADEM surface water conference this year. I'll still mail those out to you, so you'll have a physical copy in your hand very soon. I've been told that they're on their way. If you have
Hey, Summer, this is Tracy. I just checked your tracking, and it said that it arrived yesterday. Have you seen it?
Oh, really? It's probably, oh, my God. You know what, guys? Funny story. I turn around, and in my inbox is this large brown package, which I am almost positive is your fluoridation grants. I'm sorry, not your grants, your awards. Your quality awards. I'm stuck on grants. So your quality awards are actually like right here in my hands. Yay! Okay. So thanks, Tracy. I will try to get those out to you guys. If not this week, then I'll be sure to get them out to you next week. Please direct any questions you may have about this class to me. If you have any questions about the content, I'll make sure it gets to who it needs to go to. If you know exactly who you need to ask, then they will be, I've already put up everyone's contact information, but if you don't have it, just let me know and I can help you out. Oh, we do have a question. Tracy, do they come by FedEx? It's from Sandy.
Oh, yeah. Hi, Sandy. Yes, they will.
Yes.
They'll come by FedEx.
Yep, says FedEx right here on the box. Okay. All right, guys.
Hey, Summer, before, just one more quick thing.
Sure.
We had about 270 people that actually registered for this. Which is absolutely, that just thrills us to death that it was
awesome.
As well received as it was. It is our intent to let this be a yearly event and continue to, have the opportunity to award CE hours. And so we haven't quite ironed out the very last portion of this, as far as you may very well get a just kind of a brief survey, just asking a few questions about what you thought about the program and how it might be made better in the future. So once again, thanks for everybody that did register. It exceeded our expectations when it came to who we had as speakers, as well as the number of attendees. So thank you again.
Definitely. We could not have done any of this without all of our speakers' input and their help, and of course without all of you who registered and were actually interested in taking our class. And we really think that it's been a successful one, and we hope that if we ever do something like this again, that you guys won't hesitate to join us. So thank you all, and we hope you have a wonderful weekend, and of course, as always, stay safe.